So what is the axilla? Space between the medial side of upper part of the arm and the lateral side of the upper part of the thoracic cavity. So these are the boundaries of the axilla, the posterior boundaries and the anterior boundaries of the axilla. When we talk about the posterior boundary of the axilla, I will explain here the posterior surface the scapula again. These are the fibers of the subscapularis muscle. Forming the part of the rotator cuff. The subscapularis muscle forming the part of the rotator cuff, taking origin from the anterior surface or the costal surface of the scapula the muscle is the teres major. And these are the fibers of a big muscle of the dorsum, the latissimus dorsi. There is winding of the fibers of the latissimus dorsi around the teres major, so there is twisting of the fibers. So these two are forming the posterior axillary fold, and all three muscles are forming the posterior surface of the axilla. The upper and lateral part is formed by the subscapularis, the teres major and the latissimus dorsi is winding round the teres major to form the posterior axillary fold. The anterior axillary fold is formed by twisting of the pectoralis major fibers. This is the lateral head of the triceps muscle. So a quadrangular and a triangular, two triangular gaps are formed here. When we see this diagram carefully, one quadrangular and two triangular spaces are formed. This is the posterior cord of the brachial plexus. So this is the posterior cord of the brachial plexus. In the posterior surface of the axilla, the posterior cord and the axillary nerve is running in the quadrangular space and leaving the axilla, winding round the posterior surface of the upper part of the humerus, that is the surgical neck of the humerus. The other big nerve of the upper limb, the radial nerve, descending downwards and leaving the axilla through the lower triangular space. Now I will talk about the contents or the structure inside the axilla. As you all know, axilla is having 4 surfaces, 1 base and 1 apex. The medial boundary is large and formed by the lateral surface of the thoracic cavity, while the lateral surface is narrow and formed by convergence of the anterior and the posterior surfaces of the axilla. So the contents of the axilla. Then I will talk about the disposition or the orientation of the all structure inside the axilla, how these structures are entering inside and leaving the axilla. It is having arteries. The axillary artery, the second rib, the third, the fourth rib and the fifth rib. So first, second, third, fourth. And the fifth rib, the clavicle, the coracoid and acromion process, the scapula and posterior border of the scapula is here. The humerus. So this is the axilla. The apex of the axilla is formed by the posterior surface of the clavicle, the outer border of the first rib, so this is the first rib, Posteriorly, it is bounded by the upper border or superior border of the scapula and part of the coracoid process. So, axillary artery, the main structure of the axilla, this artery is coming from here.